To finish up our image analysis on sacrum and coccyx, this is part 2 of that. We're going to take a look at the lateral projection for both. Please understand that these image analysis guidelines are a little bit tailored towards performing the projections separate from each other. However, I do understand that you will not perform a lateral coccyx and then a lateral sacrum. You will do it all in one. But the image analysis guidelines still are applicable to your projection. Centering might be a little bit different, but when completing the image analysis quiz, keep in mind some of these guidelines are more tailored towards the sacrum projection by itself and the coccyx projection by itself. Image analysis guidelines for the lateral sacrum and coccyx include, for the sacrum, that the L5-S1 intervertebral foramen and the disc space should be demonstrated as open. Now understand that this projection is not a spot image like in the L spine, L5-S1 spot. However, to provide a adequately lateral projection, we still have to ensure that the patient's body position and their vertebral column are parallel with the IR. And how do we do that? We ensure that the interiliac line is perpendicular to the IR. You will utilize a sponge and place it underneath the patient's side that is down to get that interiliac line perpendicular with the IR. We do not angle just to get this disc space open. We use a perpendicular angle, or no angle, sorry, a perpendicular central ray to perform this projection. Image analysis guidelines go on to say that the medial sacral crest should be demonstrated in profile. The greater sciatic notches should be superimposed, as well as the femoral heads and the pelvic wings. The third sacral segment will be demonstrated at the center of the exposure field for a sacral image lateral projection. But if you're including the sacrum and coccyx, it'll be distal, so it'll probably be around the 4th or 5th sacral segment. Additionally, for the sacrum, image analysis guidelines say that the 5th vertebra of the lumbar vertebra, 1st through 5th sacral segments, the promontory, the 1st coccygeal vertebra, are all included within the exposure field. If you're performing the projection with the coccyx included, then the coccyx should be demonstrated in its entirety. This image here demonstrates a adequately positioned sacrum projection. I would say the 2-part IR is off a little bit here. However, we're talking about positioning rather than central ray right at this point. And this is a projection of the coccyx in its entirety, and if it was to be imaged by itself. Here I have provided the image evaluation guidelines for your review. You will find it on the Google slide that I've provided on the module. I wanted to demonstrate for you what the misalignment of the interiliac line does for the projection. As you can see, your disc space between L5 S1 is closed, and we cannot visualize the intervertebral foramen. So there is some vertebral column flexion here. If you do not place that sponge adequately to get that interiliac line perpendicular with the IR, your sciatic notches will be misaligned. Your femoral heads will be misaligned, your iliac wings will be misaligned, and your disc spaces and intervertebral foramen will be closed. And so this is not a true lateral projection. We want to get those greater sciatic notches as close to superimposed as possible to adequately get a true lateral projection of the sacrum and the coccyx. So let's review this practice analysis. First things first, we always want to ask ourselves, do we have all the anatomy within the image? And we do. Definitely could collimate it and aligned our two-part IR better, but we didn't take this projection. So that being said, while conducting this analysis, you can see that the L5 S1 disc space is closed. I believe the intervertebral foramen is closed as well. This should point out to you there may be some iliac line alignment that is off. So, meaning that the lumbar vertebral column is sagging towards the table. To correct this, you want to place a sponge between the patient's lateral body surface and the imaging table to align that vertebral column appropriately so that interiliac line is perpendicular with the IR. This concludes our segment on the lateral sacrum and coccyx image analysis. If you have any questions, concerns, just please, you can shoot me an email, or you can, when I come out to clinic, we can talk about any of this stuff, okay? Good luck on the quiz, and thank you for participating.